So tonight we're talking all things trauma therapy, and just
Let's
kind of
do
a
that.
caveat that, all of this does not have to apply for you. This does not take the place of your own individual therapy. So if something does
Yes.
not sit with you, feel free to cast it away. And
Yeah.
if this is like, oh, this is something I've never thought of before, cool, awesome, take it, use it,
Yeah.
enjoy it.
Yeah. Right on.
Yeah. So
All
starting
right.
out a little bit here.
Yeah. So, Tracy, let's just go ahead and start off. So, tell tell us, tell the audience, like, what is trauma?
So I think trauma is like known for like big things,
Okay.
right? Like
Mhm.
combat, right? Military violence, car accidents,
Yep.
sexual assault, things like that.
Yeah.
And in reality, I really think about trauma as anything that's changed how we see ourselves, the
Mhm.
world, other people. So
Yeah.
my perspective of trauma is way broader, I think.
Yeah.
And I think one of the misconceptions is that, like, in order to do like trauma therapy, something terrible needs to have happened, right?
Yeah. Right. Not quite.
Right. So, like, we always differentiate in like the trauma therapy realm of things of like the difference between like small t trauma and little t trauma.
Yeah. Yeah.
So, big T trauma is those like big trauma triggering events, right? Small
Mm-hmm.
t traumas, I always use the example of like something that was traumatic for me, right?
Yeah.
First grade, I'm peeing with the rest of my class, and a kid opens the stall door halfway through my pee, right?
Yeah. Yeah.
I'm not
Yeah.
overly impacted by it, but I will say that it has impacted how I feel, how I trust, how I saw something that I didn't see before that
Yeah.
in
Yeah.
that moment, right?
Yeah. Yeah.
So I will say, like, childhood humiliation, how
Mm-hmm.
our parents were or were not emotionally available for us.
Yes.
Um, Even things like being cheated on or a marriage ending, right?
Yes.
Um, or small things like almost being hit by a car, right?
Yeah. Yeah.
Um,
Those
or
can
being
all
yelled at,
resonate.
right?
Yes.
And no one can really define what trauma is. The DSM would
It
love
does.
to, right?
Yeah, well, I'm
Um,
sure they would. Yes.
and I think I can really make a case for most things that I see coming into my office as stemming from some sort of trauma or something that's happened in
Yeah.
someone's life, right? Um, so that's how I think about trauma. Polly, any thoughts to add?
I think you really nailed it. Yeah, I think it's what resonates as trauma for
Mm-hmm.
somebody. And that, in our work, I would imagine you see this too, Tracy, is like, folks have a tendency to minimize what is traumatic and like,
Totally.
aren't there folks with bigger problems, et cetera, that like what it is that happened for our clients
Yeah.
is what matters.
For sure. And your
So
perspective is everything, right? Like, it doesn't,
yes,
well, I don't quite know if this is how it happened. It doesn't matter. It
it
doesn't matter.
doesn't.
Your
If it
perspective of it
resonates,
is what matters.
yeah.
I know, like, an example I'll give some people. I once worked with a teenager who had some hallucinations, and that was its
Yeah.
own thing. But
Yeah.
she had a ton of trauma symptoms because what she was witnessing and experiencing was trauma.
Yeah.
Nothing was actually happening, but it was traumatic for her to have that experience, and
Yeah.
that's where we're kind of working through. So
Yeah.
anything can be trauma. And there are also people that I will say may have like one of those classic big T trauma events and not have trauma symptoms from it too. So a lot of it is just so individualized.
Yeah.
And that's why trauma informed care, I think, is so, so important in the mental health field, so
Yeah.
that someone doesn't downplay what you may feel was traumatic.
Yeah. 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 That is key. So, question for you. So the particular PTSD, post-traumatic stress disorder. Tell me a little bit about the difference between that and trauma symptoms.
Yes. So I think about trauma as, like, there's a couple different ways to think about it. Realistically, I think about our bodies are always trying to learn and grow throughout our life experience. So
Yeah.
when we experience something that shifts our worldview or how we see ourselves or the world or other people, like I said, right? Things, your body kind of adapts, right? It kind of like takes on that experience and it wants to change and shift to help protect
Yeah.
you in the future, right? So
Yeah.
I always give the example too of like, okay, so I'm living nomadically in the woods. I get attacked by an animal, and then I have heightened responses when I
Hmm.
have a certain smell that I had, or if I
Yep.
see certain things, right? Any kind
Yeah.
of sense that I can have may trigger me to be like, oh, there's danger here, right?
Yes.
And that is helpful, right? Because it
Yeah.
keeps us safe. If I'm living in the world with wolves everywhere, I want to make
Yeah.
sure that I'm not getting
You
eaten,
want to know?
right?
Yes.
Um,
Hear them
and
coming.
with PTSD, right,
Yeah.
it almost becomes too much, right? And the
Yeah.
number of people I see who have PTSD and just think they're going kooky dukes, right, is
Yeah.
amazing because all the symptoms make sense within line with what we're talking about with trauma symptoms, but they're like to an nth degree. So it is impacting
Yes.
how you're operating on a day-to-day basis. Like your functioning is definitely being impaired. And that's when we'd give like a
Yeah.
PTSD diagnosis. Usually there's symptoms of some sort of like intrusion or like re-experiencing, right? Like that could be like a flashback or something like that.
Yes.
There's avoidance
Yes.
of things that could trigger that. Negative thinking in your, or negative changes in your thinking or your mood is another kind of category of symptoms. And then like extra arousal
Yeah.
or reactivation. So those are the things we really look for, and can qualify for a formal diagnosis. And I think
Yes.
that's probably going to evolve over time, hopefully, DSM,
Yeah.
right?
Yes. Yes. It's
And
an evolving thing. Yes.
you don't need any of those symptoms to process trauma, right?
Very
So,
true.
so you don't need a
Yes.
PTSD diagnosis to be in trauma therapy, which I think is
Hmm.
something that I like would
Yes.
love to shout from a mountaintop. And
Yeah.
if you do have
Yes.
PTSD, trauma therapy will also help.
Absolutely. Absolutely, it will, to shift core beliefs and make sense of what it is that is like really happening
Yeah,
versus kind of like reoccurring in the mind. Yes.
totally.
Yeah. So, how do you approach trauma therapy? Tell me a little bit about it. And I guess how do we? Because,
We
along
do the
those
same
same
thing,
lines, we
right?
we do very similar approaches. Yeah. So
We
how
do.
do we do it?
How do we do it? How do we do the magic, right? So I think the thing that I
Yes.
really like, why I think we work so well together, is I think we both have similar approaches in how we view people. I don't think
Yeah.
either of us are overly strict with like diagnoses or like what
Nope.
criteria are you fitting. I feel
Very
like we
true.
both kind of come into this perspective of like, what has your life been? Let's look at this holistic picture of everything in your life so we can have a really strong understanding of what are the themes of your life,
Yeah.
and what
Yeah.
themes have served you and what themes are not serving you now. What might be
Yeah.
getting in the way of you just feeling comfortable and confident and like great and thriving? And
Yeah.
how is that coming into the therapy room, and what can we do to kind of help with whatever the presenting concern is? So most people aren't coming in
Yeah.
to specifically like, hello, I'd like to process trauma, because again, people don't identify that they have trauma.
Yeah.
But people could be coming
Yeah.
in
Yeah.
for, multiple different things. And
Yeah.
like you and I think we both kind of like listen for the undercurrent of like what's similar
Yeah.
from an earlier time that may be replaying now in a different kind of
Hmm.
venue of life,
Yes.
you know?
Yes. Yeah. Absolutely.
So it's like that deeper
Absolutely.
processing stuff. So like, and the thing
Yeah.
I see all the time too, and I know you get this too, is we get a lot of people who have been in therapy for years, right? And
Yes.
they come
Yeah.
in because it's just like, I know all the skills, I know all the strategies, and I get a lot
Yeah.
of the time like this, there's like, I know the stuff, but my body isn't in agreement.
Yes.
So I think that's something.
Intellectually, I get it. Yes. Intellectually, I can get it. And this still doesn't feel true.
Yeah.
Yes.
So I think that's
Yeah.
the thing that you and I do a little bit differently. It's not just skills and strategies and breathing techniques.
Yeah.
That may be a component of it, but it's more like, let's really understand what's going on here, and
Yeah.
let's bring our body into the conversation, and
Yes.
let's find what healing means for you, or what processing means for you of that trauma.
Yeah. Yeah, absolutely. You nailed it. You nailed it as to what we do. One of the things I'll add is that sort of like these patternings of behavior, it's really, so one of the first questions I ask when my client comes in is, what's been going on lately? What do you want to process? What's happened since I've seen you? Because oftentimes, even within those vignettes, like what is that's coming up, is a reflection of where we're sort of like we're puzzle out, like is a reflection working it comes from in that particular patterning. So
Hmm.
yeah,
Yeah, so true.
yeah,
So true.
yeah,
And it's amazing too. Like even like I feel like people will come in with like dreams, and I'm not like a dreamer now.
yes,
I will say that, but like you can hear themes within that too. It's like, just having
absolutely,
that objective space to help you put the patterns together can be super enlightening too, because then like here's the thing I really need to work on, as opposed to like
yeah,
here's just the stressor of the day and here's what I need and let me just do breathing techniques, right? It's like let's see what's like
yes,
underpinning all of that and work towards
yeah,
resolution.
yeah.
Yeah.
Yeah, and honoring the fact that, like, so, change is possible,
Hmm.
and also accepting sort of every step along the way, in that, like, hey, I have a patterning of doing this.
Hmm.
And that particular self-acceptance too, of like, yeah, that's kind of what I do.
And
And
compassion, like of course I do that.
absolutely,
This
yes,
this because then it gives
for a
you more
second.
choice and agency.
Yeah, yes, exactly.
Yeah.
Exactly. The ability for the pause to form and like what else is possible. Yeah. Yeah.
Yeah.
So tell us a little bit about the different modalities to treat trauma.
Yeah, so there's like a gajillion and six,
Yeah.
I think.
Mm-hmm.
And I really strive to stay up to date on a lot of the different modalities. And
Yeah.
in doing that, I've found that a lot of the modalities are just saying the same stuff,
They
but
come
like
back to the same thing.
have a
Yeah.
different like label on it, have a different price
Yeah.
tag on getting certified in X, Y, and Z, right? Um,
Yes.
as opposed
Yes.
to kind of just like taking all of those pieces together and thinking about it as like different modalities and ways to like bring that to an individual client and like piecing together what works with whoever, right? So like I
Absolutely.
know, like I'm personally certified in EMDR, which I
Yep.
think is a really good tool for like when your brain and your body disagree.
Yes.
I think it's a wonderful way to kind of just bring that connection together. But I am not like a strict like EMDRist, right? So
Mm-hmm.
like I
Mm-hmm.
don't think EMDR works for everybody, and I don't
Mm-hmm.
think it's the only way to heal from trauma. You
Yeah.
know, I think psychoeducation can just be a huge thing of like understanding like all these different pieces and how they work together. You know,
Yes.
most
Yeah.
most trauma therapies will identify that there is some sort of like the thing that shifted, right? The thing that's shifted in that experience or that event has
Yeah.
changed how you see yourself in some way, right?
Yes.
And it works to reconcile that and look at it and navigate it and figure out, is this true everywhere, or is
Mm-hmm.
this true for this specific situation? And the body's
Yeah.
going to have responses and reactions to that, and it's helping the body to kind of work through that and come to its own conclusions so that awful thing can stay in the past, right?
Yeah.
And not continue to come through, or it does come through in ways that are helpful now today in your life, you know
Yeah. Yeah.
so it like
Absolutely.
moves into this realm of like traumatic growth. And I see this in a ton of different modalities. um, I know one of the big proponents, like I like within trauma therapy, I can hit this from like just purely psychoeducation, talking inform like trauma informed care, right? I can hit this like purely cognitively of people who don't want to go there with
Yes.
their body. We can do
Yeah.
some cognitive processing therapy and totally like
Absolutely.
get to the body in a different way. We can do
Yeah.
EMDR, which is like encompassing of all of it. And I know you have like specialized training too in like somatic EMDR, which
Right.
is really kind of
Yes.
brings the body into everything as well. Um,
Yeah.
and another piece that I really like to pull into, if it's accessible to clients, is the idea of like different parts of us, to be able to kind of
Yes.
almost like personify parts and analyze like how is this helpful, because it's trying to be
Yeah.
helpful, and
It's
building
trying to be
towards
helpful.
compassion and understanding and acceptance in the body within that too.
Yeah. Yeah. Absolutely.
Yeah,
Um, can you see me okay, or am I frozen?
I can see you. Am I frozen?
Okay, good. Yeah, but that just might be me. I don't think you're actually frozen,
No.
Tracy.
Oh no, I don't. I hope not. I hope I don't.
Hey, let's talk a little bit about like, okay, and you do this a lot where you're like up here versus sort of like all the things like, and so like intellectualizing.
Mhm.
Um, I guess you touched on this a little bit, but tell me about like shoulders up, like what can be possible from there, and what more could be possible sort of beyond that.
Yes. And I will also give the caveat of this is coming from like a recovering intellectualizer.
Oh, yes,
So
I'm with you right there.
I think it's really easy, and I think when you watch shows with therapy and stuff like that, it's mostly this up, right?
Yeah,
Of let me
it
think
is.
through this, like let me problem solve this, let me figure it
Yeah,
out,
let me
and
figure
I
it
think
out.
I
Yes.
think good therapy, good trauma therapy, like has to bring the body in, right? Has to
Yeah,
have a therapist who's like responsive to when the body wants to like show up in a session, right? So like I don't
yeah,
know if I'm sure you see this, right? But like you're like talking to
absolutely.
someone and then like this emotion just like overcomes them and out of nowhere and then it's like
Yeah,
what's that? What's that
yeah,
thing? What's that thing you're doing
yeah,
right there? You know,
yeah,
it's slowing down and bringing the body into it. And a lot of the times people be like, I don't know. I have no idea because I
yeah.
live here on up, right?
You're up. Yes.
hmm So,
Yeah,
and that's okay. You don't have to know. And I know this is
yeah,
something I still struggle with too, in my own life and therapy and whatnot too. Of like sometimes it's really hard to just slow down and be like, what's up? Like, where am I at?
yeah.
What is this?
Yeah,
Um,
absolutely. Therapists don't make the best therapy clients.
no, we think too much.
We think too
We're
much. We're
hard.
tough.
We're
We're
tricky.
tough. We're tough.
We're tricky.
We are.
Yeah.
We're the
But I think this
trickiest.
happens for a lot of people. Like a lot of people who are
Yes.
analytical feel like there's a way to solve
Yes.
anxiety, feel like there's a
Yeah.
way to solve depression. And a lot of it like it's missing the point. It's missing the
Yeah.
point of just like being with and offering compassion, because when you're
Yeah.
trying to solve something, indirectly you're also offering judgment to it. And that's just
Yes.
further entrenching
Absolutely.
it.
Yes. Yes.
So I think
Yep.
that's the thing to know that like if you've been in therapy, like I think that's the thing that we see when people say, I've been in therapy for years, they've been doing this kind
Hmm.
of therapy.
Yeah.
And when we can really
Yeah.
kind of dig in to themes, dig into the body, or at least like be aware of all that stuff that's coming in with really a holistic perspective, I
Yeah.
think that's when we can see the most progress personally.
Yeah. Absolutely. Yeah. I noticed that too.
hmm
Um, anything else you want to talk about trauma?
Oh my gosh, I could go on for like
Yeah.
hours. No,
Yeah.
there's so many cool ways to access this stuff. And I will say too, therapy doesn't always have to be the thing, you know. Um,
Very true.
you
Very
know,
true.
it's
It's one
sometimes
of, just
yes.
like we have a whole bunch of modalities inside of our practice,
Mhm.
there are places and other spaces of healing that aren't
Absolutely.
just in, the therapy room.
Yes.
Yes. Yes.
Yes. And
Yes.
there's so many options. There's so many things we can use with therapy to supplement, or like if therapy's not your thing, but like some of this resonates, there's other spaces
Yes.
to explore that too.
Yep.
Um, I know there's like body practitioners who do different kinds of things that can be
Yes.
supportive.
Yes.
I know that there's like yoga practices that can be really helpful in releasing emotion too.
Yep.
Acupuncture, massage, like there's a
Yeah.
ton of things that
Cranial sacral therapy.
a jillion
Hmm.
percent, yes,
Yeah.
and can help you learn to be with your body too. You know,
Yes.
so
Yeah.
there's so many different modalities as well. Um, I legit could go on like 80 different tangents right now, so I
Yeah.
should just like I'll have to do like a mini series on
Yeah,
like
I
trauma.
love it. A mini series, yes.
So,
Um, I mean, one of the things, um, when we see healing actually happen, it's some of the coolest stuff. And when I say that, I want to honor and name that this can be over some time.
mm-hmm.
But when we, as therapists, sit in our chair and just watch some of the successes of our clients, it's just, I mean, it gives me chills of.
Mm-hmm.
And some of
Yeah.
my favorite times in therapy, or like not times, but like when we do get the opportunity to reflect of like, here's where you were a year ago. Oh my goodness, look at all of the change that has happened. And it's just, I think that that can be super cool. And I think that kind of like, let's go back and just honor this
Mhm.
amazing work and how much healing has happened. It's
Yeah.
cool.
Yeah.
Super cool.
I mean, I have like no real filter. So when those moments happen, I'm like geeking out, like in my office, just like,
Are you the hype girl?
I am the hype. If you want a hype therapist, I'm your girl. Like I will, like my clients, if anyone like watches this, will exactly know what I'm talking about because I'm like,
Yeah.
ah! It's a whole thing.
Yeah.
It's a whole thing. It's very exciting to me. But I'll let you know
Yes.
when you're healing because I'll
Yeah.
hear it. No
Yeah,
one
yeah,
gets,
right. We'll shout it from the rooftops.
and then I have to
Whoop
like
whoop.
process it later for myself. Be like, was that appropriate? I don't know. I don't care.
Bring it to consultation.
I'll bring it
We'll
to
we'll work it out.
consultation. Be like, I
We'll
don't know
work
if
it
this
out.
is right or not, but I got real excited. I get really excited about like psychoeducation on trauma too. I feel like it's
Oh
like a
yeah.
mountain somewhere. Ta-da!
Absolutely. Yeah.
Anyway,
Yeah.
all right. So
So
our
cool.
next,
Next.
the next one's the last
Yeah.
one, Polly.
I can't believe that.
We're getting there.
Um, and I'm super excited about it. We're going to be talking a little bit about panic attacks. And yeah, just some of those like really gristy moments that we have in life and why they come up and what to do about it.
Yeah, I'm excited for
Yeah,
that because I know you have really specific like knowledge within that. I know kind of what's been helpful in my practice, but I'm really excited to hear from you on your
yeah,
perspective that way. We do have a
yeah,
question.
absolutely.
We have a question in the chat.
We do. Oh my God.
So the question
I
is,
can't
what
even think of.
does modality mean? So
Ooh,
that's a really good
modality.
question.
Yes, sorry. I
So
apologize that we got jargony.
sometimes we get a little
Sometimes we get
jargony. I think
jargony.
this is the hard part of like
Modality.
being a therapist is sometimes I don't know what's jargon and what's not anymore. Because
Right.
I'd like to think
Okay.
I speak in pretty layman's terms, but I don't think I do all
Yeah.
the time.
Well,
So
let's go back to
modality,
that question. So I
yes.
think I said, what are the different modalities to treat
Mm.
trauma? We could
Mhm.
probably swap that word out with like ways or theories or practices. What do you think, Tracy?
Yeah, I think so. Here's your like therapist sneaky peek, right? So if you're going to
Yeah.
be like a therapist, you take a class called theories, and within
Yes.
that, you get a lot of different modalities or different ways that like experts have thought about treatment or
Yeah.
progress or
How do we
healing,
look at it?
right? So like
Yes.
one guy is like, all you need to do is like believe in your client and be positive and just like
Yes.
be all loving and progress and change comes from that, right?
Yeah.
There's someone else who's like everything you think you like what you think, what you act or behaviors and like what you feel are all going to like you manipulate your thoughts and then you're going to be fine.
And then you'll be
um,
fine.
Somatic therapy, like
Yes.
Polly's talking
Where
about,
do we
like it's all about
experience
like
this in the
allowing the
body?
body to like
Yes.
move
Yes.
through, right?
Yeah.
EMDR is a specific modality that like is bilateral stimulation to
Yep.
help kind of that communication in your body. So it's just different like treatments, if you will.
Different ways.
So like for instance, if you had the flu, right, and your doctor might
Yeah.
be like, okay, you could take this,
Air flu.
right?
This stuff. That stuff.
Exactly.
Nutty
So that's what
pot.
a modality is. So when we're
Yeah.
talking about that, it's just basically saying there's all these different treatments. And the cool thing about therapy and the cool thing about being a therapist is like it's not just like one specific pill. We can kind of take
Yes.
these different things and weave
We
them together
can.
to be like, look,
Yes.
you get the best of it all, and it's all tailored specifically to you and what you need to heal.
Yes, yeah, absolutely. So some people love specific modalities of like of homework. And I love it when a client tells me like, here's what's working and here's what's not. I really don't want to come in and talk about what has been happening. I want to go way back to the thing and process the thing. Okay, I got you. Some folks are like, give me something to do outside of here. Some
Mm-hmm.
folks are like, and so honoring and listening to that, I mean, that's a part of like the relationship sort of in and of itself.
Totally.
Um, so yeah,
Yep. Or being like, I don't know what I need. I don't know what we're doing. And
I
then we'll
don't
be like,
know.
cool, let's try some different stuff and see what
Yeah,
is your
right.
quilt that we will make.
Yes, absolutely. Yes. I love that we had a question.
I
That's
know.
so fun.
Love questions. It's good.
Me
We should do
too.
a Q&A sometime.
That'd be fun. I want more questions, I do have to
I
say.
know. I know. I could talk all night though, and we're
Yeah,
getting long, so we should
right, right.
wrap it up. Okay,
Yeah.
so next, no, not next week, the 30th, talking about panic.
Yep.
Let's talk panic, real conversations. And
Let's
that'll be the
talk
last one
panic.
to wrap
Some
this up.
real
And if this is something that
conversations.
anyone's enjoyed, feel free to shoot us a message or something like that. And be like,
Yeah.
hey, please let us know, and we'll happily do more of this stuff. Um,
Yeah.
Otherwise, yeah, I don't know. Anything else you got, Polly?
I don't. Super excited.
No. Yeah.
Yeah. I mean, truly, it is the end of summer coming up, and I'm glad we have one more to grow on beyond summer and autumn.
I know. I'll
Yeah.
have to get a balloon or something.
Yeah. Yeah.
All right. Well, thank you everyone for joining us. We will see you on the 30th.
Hooray.
And this will, I swear, these will be uploaded on the website soon if you missed it, because I just got to get around to it. Okay.
Yeah.
I'll work on
It'll
it.
happen. They will
It'll
be
happen.
there.
It'll get there.
Yes.
Things and stuff. It's all good.
It'll happen.
All right. Lovely talking to you,
Okay.
Polly. Thank you
Good
everyone for
night,
joining us.
everybody. Thanks,
Yeah.
Tracy.
Bye bye.
Bye.